Have you ever noticed a subtle change in your body's scent and brushed it off as nothing? What if that very scent was a silent alarm, your body's way of warning you about a hidden danger? It may sound unbelievable, but science reveals that changes in body odor, breath, or sweat could be the earliest signs of a serious illness, including cancer. Cancer is one of the most life-threatening diseases worldwide, yet it rarely announces itself with clear symptoms in the beginning. Instead, it sends quiet, almost invisible signals that many of us overlook. Imagine if recognizing a specific scent could mean the difference between early detection and a late-stage diagnosis. Would you be able to pick up on these hidden clues? In today's video, Healthy Care will uncover 8 surprising cancer-related smells that could save lives. Stay with us until the end, because what you learn today might make all the difference for you or someone you love. Let's dive in. You might wonder, how can cancer affect body odor? The answer lies in the way cancer disrupts your body's normal functions. Cancer often causes subtle yet significant changes in your metabolism, leading to the production of unique chemical compounds. These compounds, also known as volatile organic compounds, VOCs, can alter the way your body smells, including your breath, sweat, or urine. Here's something fascinating. Research shows that certain cancers, like lung cancer, skin cancer, and bladder cancer, produces distinct chemical markers that the body releases into the air. These compounds are often imperceptible to humans but can be picked up by trained animals, particularly dogs. In fact, trained dogs have been able to detect cancer in its early stages with astonishing accuracy, often before medical tests reveal anything abnormal. It doesn't stop there. Scientists are now working to develop advanced devices that mimic a dog's sense of smell to detect these compounds. These technologies, like electronic noses, could revolutionize how cancer is diagnosed in the future. Imagine a simple device that could detect cancer just from analyzing a sample of your breath or sweat. But until this technology becomes widely available, paying attention to your body's signals is critical. A persistent, unusual smell, one that's unexplained and doesn't go away, could be more than just an odd occurrence. It might be your body's way of telling you to take action. Ignoring these subtle signs could mean losing valuable time for early diagnosis and treatment when cancer is still manageable and survival rates are highest. The idea that cancer could be detected through smells might seem surprising, but it's a concept firmly grounded in science. The human body is constantly sending signals, sometimes through symptoms we can see or feel and sometimes through odors that change without explanation. These smells, while subtle, could be life-saving clues if recognized early. So how can you tell when something isn't right? What smells should you be aware of? In the next part of this video, we'll reveal the 8 most common smells that could serve as warning signs for different types of cancer. By staying informed and paying attention to these subtle changes, you'll be better equipped to take action early, and that could make all the difference. Let's explore these signals together, because early detection is key, and your health is worth it. 1. The hidden mold, the mouth and throat cancer warning. Mouth or throat cancer is a serious condition that can be difficult to detect in its early stages. One of the most surprising and little discussed signs of this disease is the peculiar smell that resembles mold or rotting wood. This odor is caused by several factors, including secondary infections, tissue necrosis, and the release of volatile compounds from tumors in the mouth or throat. As the cancer progresses, these compounds accumulate and generate the characteristic odor. People around you may notice this smell when talking to someone who has the symptom, as it is most noticeable on their breath. Unfortunately, it is often associated with poor oral hygiene or dental problems, which can delay seeking medical help. The musty odor is often accompanied by other important signs. These include persistent hoarseness, difficulty swallowing, sores in the mouth or throat that do not heal, white or red spots in the mouth, and even unexplained ear pain. If the musty smell is present along with these symptoms, it is essential to see a specialist, such as an otolaryngologist or oncologist. Tests such as biopsies, CT scans, or MRIs can help identify the cause of the problem. Although mouth or throat cancer is a serious condition, its chances of cure are significantly greater when diagnosed early. Therefore, never ignore changes in breath or other unusual signs related to the mouth and throat region. If you notice this persistent smell or other associated symptoms, take action immediately. 2. The odor of decomposition, the clue to colorectal cancer. Colorectal cancer is one of the leading causes of cancer deaths worldwide, but its early signs are often ignored or confused with common gastrointestinal problems. Among these signs is a change in the smell of feces, which can become much stronger, more persistent, and have an odor similar to decomposition. This unusual smell occurs because colorectal cancer interferes with the digestive process, causing the release of toxins and gases that alter the natural odor of feces. These changes may be associated with incomplete digestion or the accumulation of toxic substances in the intestinal tract. Although it is normal for the smell of feces to vary due to diet or medication, when the odor of decomposition becomes frequent and unexplained, you need to be cautious. This odor may be accompanied by other worrying symptoms such as blood in the stool, persistent abdominal pain, changes in bowel habits, and unexplained weight loss. One feature that makes colorectal cancer particularly dangerous is that many symptoms, including changes in smell, only appear in more advanced stages of the disease. Therefore, noticing changes in odor may be one of the few early warnings available before the problem worsens. If you notice persistent changes in the smell of your stool, don't hesitate to see a doctor. Exams such as colonoscopy, stool analysis, or imaging tests can help identify possible abnormalities in the intestine. The good news is that colorectal cancer, when diagnosed early, has a high chance of being cured. Being aware of changes in the body, like the odor described, can save lives. 3. The sweet that scares, the smell of breast cancer. Breast cancer is one of the most common diseases among women, but it can also affect men, although it is rare. One of the lesser-known and more unusual signs of this disease is a sweet, unpleasant smell that can emanate from the skin or wounds associated with the tumor. This odor occurs especially in more advanced cases of the disease when there are infections or tissue necrosis in the affected area. Cancer cells, when growing uncontrollably, can cause inflammation and local infections, releasing chemical compounds that result in this characteristic smell. Open wounds or ulcers on the breast are often the source of the odor. This sweet smell can be mistaken for signs of simple infections or poor hygiene, but its persistence should serve as a warning of something more serious. In addition to the smell, breast cancer often presents other important signs, including lumps in the breast or armpits, changes in the texture or color of the skin, abnormal secretions from the nipple, and persistent pain in the region. Any combination of these symptoms, especially accompanied by a sweet and unpleasant odor, requires immediate medical attention. The biggest challenge is that many people ignore the initial signs, believing that it is not something serious. This negligence can delay diagnosis, reducing the chances of successful treatment. Breast cancer has high cure rates when detected early. Therefore, paying attention to the signs, including the characteristic smell, can save lives. If you or someone close to you notices unusual changes in skin odor or sores in the breast area, seek medical attention immediately. 4. Sulfur in breath, a sign of stomach cancer. Gastric cancer is an insidious condition that often presents with vague symptoms that are difficult to detect. However, one of the most notable signs may be in your breath, the smell of sulfur or rotten eggs. This odor occurs due to improper digestion and the release of sulfur gases in the digestive tract. When the stomach is affected by cancer, it cannot process food properly, resulting in the production of volatile compounds with a characteristic smell. Bad breath related to gastric cancer is persistent and does not go away with oral hygiene or changes in diet. It can be confused with minor gastrointestinal problems such as acid reflux or gastritis, but its persistence should serve as a warning. In addition to the smell, gastric cancer can bring other symptoms that reinforce the need for medical attention. These include abdominal pain, a constant feeling of a full stomach, loss of appetite, frequent nausea, and, in advanced cases, blood in the stool or vomit. One of the reasons for the late diagnosis of gastric cancer is the similarity of symptoms to more common and less serious conditions. The smell of sulfur, although subtle, can be one of the first signs that something more serious is going on. Being aware of this odor and associated symptoms can be the difference between detecting the disease early or when it is already at an advanced stage. If you notice persistent changes in your breath or other digestive signs, see a gastroenterologist for an evaluation. Remember that gastric cancer, when diagnosed early, has more effective treatments and a greater chance of success. 5. The horror of rotten meat, skin cancer warning. Skin cancer, especially melanoma, is one of the most dangerous types of this disease. It can manifest itself in many ways, and surprisingly, one of the signs can be smell. People with advanced skin cancer often report an odor reminiscent of rotting flesh or something decaying. This smell is the result of cancer cells that begin to necrotize, releasing volatile chemical compounds that cause the unpleasant odor. The smell of rotting meat can appear in open wounds or skin lesions that do not heal. These injuries, often ignored or mistaken for simple bruises, can be the first clue that something is seriously wrong. One of the reasons this signal goes unnoticed is its location. Skin lesions or wounds may be in areas that are difficult to see, such as the back or scalp. Additionally, the odor can be attributed to hygiene problems, common infections, or even the use of certain cosmetic products. Other symptoms often associated with skin cancer include changes in the color, texture, or size of spots and moles. If a spot darkens, grows rapidly, becomes irregular, or begins to bleed, it is crucial to seek medical evaluation. When these signs appear along with the odor of rotting meat, the urgency for a diagnosis increases. Melanoma, in particular, is known for its high mortality rate when not treated in time. However, early detection can save lives, as treatments have a greater chance of success in the early stages. If you notice a persistent unpleasant odor coming from a skin wound, don't ignore it. See a dermatologist for a detailed evaluation, even if the smell seems small or insignificant. 6. An alarm in urine, the smell of ammonia from the kidneys. Kidney cancer is a serious condition that often develops silently. However, one of the most unusual clues the body can give is the smell of urine. A strong, pungent ammonia odor may be one of the first warning signs. This smell occurs when the kidneys, which have the function of filtering the blood and eliminating toxins, begin to fail. With cancer affecting their function, there is an accumulation of chemical byproducts in the body, such as urea, which generates the characteristic smell of ammonia. It is important to highlight that not every ammonia smell indicates cancer. Urinary tract infections, severe dehydration, and high-protein diets can also cause changes in urine odor. But if this smell is persistent and accompanied by other symptoms, it is essential to investigate further. Symptoms that often accompany kidney cancer include back pain, blood in the urine, intense fatigue, and unexplained weight loss. These signs, combined with the strong ammonia smell, should not be ignored. An additional problem is that people are often hesitant to seek help because they believe the symptom is not serious. However, kidney cancer is more likely to be treated successfully when diagnosed early. Paying attention to changes in the smell of your urine can make all the difference. If you notice this odor associated with other symptoms or if it appears inexplicably, make an appointment with a doctor immediately. 7. Metal in the air, a danger signal in the blood. A metallic odor is another unexpected sign that can be associated with a serious illness, blood cancer. People with leukemia or lymphoma often report a metallic smell coming from their breath or sweat. But where does this odor come from? It is caused by changes in the levels of iron and other chemical compounds in the blood. When cancer cells interfere with the production or destruction of healthy cells, they also affect the body's chemical balance, generating compounds that result in a peculiar smell. This odor is described as similar to the smell of rusty iron or old coins. It can be noticed mainly in situations of excessive sweating or after light physical activity. The biggest problem is that this sign, being subjective and not causing immediate discomfort, is easily ignored. Most people associate the smell with changes in the environment, diet, or hygiene without realizing that it can be a serious warning that something is wrong. In addition to the metallic odor, leukemia and lymphoma present other symptoms that together form a worrying picture. These include extreme fatigue, persistent fever, recurring infections, and unexplained weight loss. If a metallic odor is present along with these symptoms, seeking medical help should be the priority. Leukemia and lymphoma are diseases that can progress quickly, but with early diagnosis, the chances of successful treatment increase significantly. If you notice a persistent metallic smell, especially on your breath or sweat, don't ignore it. Think of it as a signal from your body asking for immediate attention. 8. The sweet nobody wants to smell, the smell of lung cancer. Lung cancer is one of the most silent and dangerous forms of the disease. It can develop without showing visible symptoms for a long time, but in some cases, there is an unexpected sign, the smell. People with lung cancer may report a sweet, slightly fruity odor coming from their breath. This smell is caused by the release of volatile organic compounds in the lungs. These compounds, generated by the altered metabolism of cancer cells, accumulate and can be detected in the breath. Although this smell is very similar to that of fermented or spoiled fruit, it is different from common bad breath. It does not disappear easily with oral hygiene and, above all, tends to be persistent. Unfortunately, this sign can go unnoticed for months, as it is easily confused with other conditions such as digestive problems or even diabetes. Therefore, it is essential to pay attention if the odor is frequent and without an apparent cause. Lung cancer also tends to present other symptoms that, when combined with the smell, should be investigated. Among them are persistent cough, difficulty breathing, hoarseness, and chest pain. If these signs are present, it is essential to see a doctor immediately. Lung cancer is one of the most lethal, but it is also one of those with the best chances of treatment when detected early. Therefore, being aware of the sweet and fruity odor on your breath can be a decisive factor in saving lives. Have you ever considered that something as subtle as a smell could be your body's way of calling for help? Our bodies are remarkable, constantly sending signals, some obvious, some so faint they're easy to ignore. But recognizing these hidden warnings could mean the difference between early detection and a missed chance to fight back. The odors we've explored today might seem minor, but they can be life-saving clues. Ignoring them could cost valuable time that could mean the difference between a treatable condition and a dangerous late-stage diagnosis. Your health is your greatest wealth. A strange, persistent smell isn't just a curiosity, it's a sign that your body is trying to tell you something. Will you listen? If you or a loved one has noticed any of these unusual odors, don't wait. Take action now. Seeking medical advice early could save a life, maybe even your own. By staying informed and sharing this knowledge, you're not just protecting yourself, you're empowering others to take charge of their health. Awareness can make all the difference. Your body whispers before it screams. The sooner you listen, the better your chances. If you found this information valuable, support our mission by giving this video a thumbs up, sharing it with others, and subscribing to Healthy Care for more life-saving health insights. Together, we can make a difference. Stay aware, stay proactive, and we'll see you in the next video.